Is type 2 diabetes mild or severe due to complications? Statistics show that people with type 2 diabetes have very little risk of dying from hyperglycemia, but mainly because of complications of the disease, of which 65% are cardiovascular complications. Complications of the disease also cause patients to face the risk of disability such as amputation, kidney failure, blindness. Complications of type 2 diabetes. Complications of type 2 diabetes can have serious effects on the nervous system, heart, retina, and kidneys. Neurological complications. This complication often causes numbness and burning in the hands and feet. More severe conditions will cause loss of sensation of pain, heat, or cold. An injury can go unnoticed, progressing to serious wounds, ulcers, and infections. Cardiovascular complications. High blood sugar will cause atherosclerosis, increasing heart rate. The most dangerous thing is to cause heart attacks without warning. Retinopathy. Diabetes damages blood vessels in the retina, bleeding, which can cause retinal detachment and blindness. Kidney disease. High blood sugar also damages the kidneys. If not prevented early, the disease will cause kidney failure, requiring lifelong hemodialysis or a kidney transplant. People with diabetes suffer from severe complications such as kidney failure, myocardial infarction, and stroke, often worse than cases of peripheral nerve complications, skin complications. The more complications appear, the more severe the disease and the more difficult it is to treat. Type 2 diabetes is severe or mild compared to type 1 and type 3. Type 1 diabetes occurs when the pancreas is no longer able to produce insulin. The symptoms of the disease are very severe. Patients are easily detected and treated early, reducing the risk of complications later. However, the treatment for type 1 diabetes is more limited than that of type 2. With type 2 diabetes, the disease progresses silently over many years, starting with insulin resistance and gradually reducing insulin secretion by the pancreas. There are many ways to treat the disease, but the disease is often detected late. Many cases have complications at the time of diagnosis. In type 3 diabetes or Alzheimer's diabetes, patients have memory impairment, so it is difficult to comply with treatment. Therefore, the possibility of complications and the degree of complications is also more severe than type 1 and type 2. It is difficult to compare whether type 2 diabetes is more severe or mild than type 1. You need to understand the characteristics of each disease to avoid panic that affects the effectiveness of treatment. Warning signs of complications of diabetes. You can detect when your diabetes is getting worse through some of the following warning symptoms. Wounds take a long time to heal. Heart beat fast when resting. Or leg pain when walking, claudication. Nails thicken, skin peels, and itch. Blurred vision, see black spots, or pain, watery eyes. Heavy limbs, stiff knees, shoulder joints, nocturnal cramps. Numb limbs, burning, stinging like needles, and scrawling on the skin. If you just subjectively wait until complications appear before treatment, it seems to be too late because the battle to regain health will be even more difficult. It is best to proactively prevent complications from the very beginning to reverse the disease quickly. How to prevent diabetes complications. The secret to delaying and minimizing the effects of diabetes complications is to strictly follow your doctor's orders. At the same time, the patient should also persevere in building a healthy lifestyle to better support the treatment of the disease. 1. Strictly follow the doctor's orders. Many people think that normal blood sugar means that the disease is cured, so they voluntarily stop taking the treatment. However, this only indicates that your disease is stable, not that you are cured. Therefore, you should still continue to take the drug and reduce the dose only after consulting your doctor. 2. Persevere in building a healthy lifestyle. The goal of building a plan of eating, combining exercise and reasonable rest is indispensable in the treatment process. Diet. Diabetics do not need to abstain from any food, just eat less starchy foods and control the amount of food each meal. You can apply the plate principle to accomplish this. Fill 1/2 plate with green vegetables, 1/2 starch, rice, vermicelli, and 1/2 salty dish, meat, fish. You should also remember to eat vegetables at the beginning of the meal to lower blood sugar better. Exercise, this is the simplest way to reduce insulin resistance. However, this benefit is only achieved when you persist in exercising for 20 to 30 minutes a day or at least 5 times a week. Get enough sleep and relax. When stressed or lack of sleep, the body will release many hormones that cause blood sugar to rise. Therefore, you should try to sleep 6 to 9 hours a day and keep your mind relaxed.